So every year in this country, paramedics respond to 400,000 cardiac arrest calls. And despite their best effort, 90% of those people won't make it. That's right, 90%. Cardiac arrest is the single biggest cardiac killer in this country. It kills more patients than heart attack and stroke combined. I'm Tony Voyers, CEO of Novocor Medical, and we're developing devices for paramedics to help improve the outcomes for these patients. The best care that a cardiac arrest patient can get right now is to quickly get high-quality CPR and airway management, followed by defibrillation, and then something called therapeutic hypothermia. That's lowering the body's temperature to slow the metabolic rate. And while paramedics have good tools and good training for CPR and for defibrillation, they really struggle with delivering therapeutic hypothermia. What they're doing in the field right now is infusing 2 bags of ice-cold saline as quickly as possible. And the ice-cold saline actually does a really nice job of lowering the patient's body temperature. But the paramedics struggle with having access to this saline. What they try to do right now is to keep it cold in advance. And they've looked at installing refrigerators on the ambulances, but if you looked in the back of an ambulance, there's not a lot of space there, so they really can't do that. They've also deployed the strategy of putting it in an ice chest, an igloo cooler, and changing out the ice 3 times a day, and that's a huge hassle factor. But either way, as soon as they pull that bag of saline out of the refrigerator to the ice chest, it starts to warm up, just like a beer would in the summertime. So they really don't know what temperature that saline is going in the patient, and they don't know how effective that therapy is. Here in Wake County, the EMS system is one of the leading therapeutic hypothermia systems in the country. And what they've done is decided to install refrigerators on their backup vehicles and their supervisory vehicles because they don't have room on their ambulances. So if I went in a cardiac arrest right here, right now, I hope somebody would call 911. The paramedics would get here, they'd rush in, they'd start giving me CPR and defibrillate, but it might be 15 minutes or more before that supervisor or backup vehicle got here. They would then take 2 bags of saline, rush in here, and start giving them to me 15 minutes later than I could have had benefit of that therapy. And all the while, those bags are warming up. So Novocor has developed Hypocor to address these issues. It's an inline saline chiller. It's powered off of an endothermic chemical reaction, just like an instant cold pack. It fits seamlessly into what they're doing right now. A normal bag of saline, a normal IV kit. Paramedics know intuitively how to hook it up. You start the flow of saline, you turn on the device, and instantly the saline is chilled right before it goes into the patient. A very effective method for getting the patient cold quickly. It's small, it's portable, it can be stored anywhere on the ambulance. They can bring it in here, and they don't have to worry about that saline warming up as it's being infused. So as a company, we're relatively young, probably one of the youngest companies up here, less than 2 years old. I was at this conference 2 years ago, had not formed the company yet. But in that time and on a very skinny budget, our team has done a great job. We licensed the technology from NC State. We then went out and raised a Series A from local angel investors, and we put that money to work. We now have 2 issued patents, but most importantly, we've gone through 12 iterations of the design, getting feedback from medics and doctors all the way. And we locked our design earlier this year. And that's a huge step for us. So now we're tooling up. We're going to be building a couple hundred units later this spring. We're going to be doing our design verification testing this summer, because 2015 is all about getting FDA approval for us. We'll be submitting our 510K at the end of the summer, and that should set us up great for a launch first quarter of 2016. And as proud as I am of our team that has worked on this, we really couldn't have done it alone. It's this community that's helped us. All these groups on the screen have given us help in some way, shape, or form through the licensing from NC State, advice, introduction to investors, space to work on our technology. We really couldn't have done it without you, so I'd like to give a big thank you to this community. But I also have an ask, and that is, yeah, absolutely. I have an ask, and that is to keep helping us. I mean, we're going to be doing a Series B to help fund our commercialization efforts later this year, and we'll need new investors, so introductions there. And Lord knows, if you ask my wife, I need advice every day of the week, so that advice is really paramount. Because after all, we all want the same thing, and that's more of these cardiac arrest patients walking out of the hospital under their own power and going home. Thank you.